Triumph over tooth decay. Procter & Gamble announces Crest toothpaste with Fluoristan, its exclusive fluoride compound, world's greatest weapon against decay.
Look, Mom, no cavity.
For decades, you've been told to brush your teeth twice a day, to use toothpaste with fluoride. That it's the best way to prevent cavities. That it's safe. That it's necessary. But what they never told you is that the star ingredient you put in your mouth every single day was once rat poison, a pesticide, a substance so corrosive it can dissolve concrete, a toxic industrial byproduct, recycled as medicine, an industrial chemical that overnight went from being rat poison to being recommended by pediatricians, dentists, and governments.
Fluoride is safe and effective, and it's one of the most inexpensive ways to really cut down on dental decay.
Anything we can do to help prevent cavities on children, I think, is very important.
Absolutely, fluoride is safe, it's effective.
Fluoridation of community water is extremely safe and extremely effective in preventing tooth decay. Science is on the side of fluoride being safe and effective. There is no controversy about this in the scientific community.
Fluoride wasn't born in a medical lab or in a university. It was born in heavy industry. During the 19th century, sodium fluoride was used as a pesticide, rat poison, and disinfectant. Journalist Christopher Bryson documented it in his book, The Fluoride Deception.
Fluoride science is DDT science, it's asbestos science, it's tobacco science, it's a racket.
In July of 2004, Christopher Bryson sat down and discussed the findings of his new book, The Fluoride Deception, with Paul Connett of the Fluoride Action Network. The Fluoride Deception was published by 7 Stories Press in May of 2004. The book is based on nearly 10 years of research by Bryson, an award-winning journalist and former producer at the BBC.
Fluoride was known to cause serious illness in factory workers, kill livestock, and even cause human deaths through accidental exposure. Alcoa, the aluminum giant, was one of the main fluoride polluters. Its toxic emissions destroyed crops, poisoned animals, and ruined nearby lands. The solution? It wasn't to stop polluting. It was to turn the problem into business. The legal problem was so big that Alcoa began paying millions in settlements. Then something else, convenient, happened. Andrew Mellon, founder of Alcoa, was also Secretary of the U.S. Treasury and therefore oversaw the country's public health. Conflict of interest? Absolutely. Mellon founded the Mellon Institute, a scientific research center funded by industry. That's where Gerald Cox worked, the man who first proposed adding fluoride to drinking water. His source? Incomplete studies. His motive? Avoid million-dollar lawsuits. Soon after, the first human experiment began in Grand Rapids, Michigan. 107 barrels of fluoride were added to the water supply. The study lasted only 5 years. The children born at the start of the experiment didn't even have permanent teeth by the end of it. How do you convince an entire nation that poison is health? With propaganda. Edward Bernays, Freud's nephew and the father of public relations, was hired by the government to sell the idea of fluoride. Bernays wrote, "If we understand the mechanisms of the collective mind, we can control the masses without them knowing it." And that's exactly what they did. Educational campaigns, TV ads, dentists repeating slogans, all driven by economic interests disguised as science.
Tom, for unpleasing breath, I advise Colgate Dental Cream, because only Colgate's has proved so completely it stops bad breath. Scientific tests prove that in 7 out of 10 cases, Colgate's instantly stops unpleasing breath that originates in the mouth. Yes, Colgate's has the proof. It cleans your breath while it cleans your teeth. Moreover, Colgate's is preferred for flavor over all other brands tested. And dental research has proved brushing teeth right after eating with Colgate Dental Cream stops tooth decay best.
The effects of fluoride were known. A 1948 study examined 95 workers exposed to hydrofluoric acid. Their teeth fell out. Their gums bled. Many were almost completely toothless. The published result? That they had fewer cavities. The reason? They had no teeth. The full version of the report was censored. What was published was a half-truth, carefully edited, Today, 95% of toothpaste in the US contains fluoride. 72% of the water is fluoridated. And yet, 98% of Europe has banned it. China, Austria, Belgium, Germany, Norway, Sweden, Japan, all say the same thing. Fluoride is toxic and ineffective. So, why does the US keep using it? Why do millions consume it daily without knowing it? What they call fluoride is not natural fluoride. It's hydrofluorosilicic acid, an industrial byproduct of phosphate fertilizer. A chemical so corrosive it dissolves concrete, glass, and steel. When a tanker truck leaked in Rock Island, Illinois, the product burned through the ground. That same product is poured every day into the drinking water of millions of people.
First tonight, hazmat crews from all across our area responded to a chemical leak this afternoon in Rock Island. The chemical was so strong that it was burning through the concrete there. News 8's Christy Mergenthal has the latest.
It was just before 1 o'clock Thursday afternoon when hazmat crews were called to the Rock Island water treatment plant for a chemical spill coming from this tanker truck. The chemical hydrofluorosilicic acid is used to add fluoride to the plant's water. After several hours, crews were able to clean up the leak, allowing operations to return to normal.
They had to cordon off the area, obviously, but as far as the treatment of the water and the amount of water being used by the public, there's no effect on that at all.
Now, that acid that did spill out is a chemical that they actually use every single day here at the water treatment plant. It adds fluoride to the water.
And the industry sells it as if it were a supplement. Fluoride was sold as medicine. But from the beginning, it was a move to hide industrial waste. A multi-million-dollar campaign of public manipulation. There is no other chemical added to drinking water with the purpose of treating people. None. Only this one. Fluoride wasn't approved by doctors. It was imposed by lawyers, industrialists, and experts in social control. Not through open debate, not through science, but through influence, marketing, manufactured consent. They didn't ask for your approval. They bought it. Because when you control the narrative, you don't need facts. You only need repetition, emotion, authority. Fluoride didn't just become accepted, it became mandatory. A government-endorsed additive, a routine, a belief. But this wasn't the first time something dangerous had been sold as health. And it wouldn't be the last. In the early 20th century, cigarettes were marketed as symbols of sophistication. Ads showed elegant women lighting up in evening gowns. Doctors in white coats saying, "I smoke Camels." Hollywood stars smiling with a cigarette between their fingers. The message was clear: smoking wasn't just safe, it was refined, it was smart. Behind that message, the same man, Edward Bernays, the father of public relations, the man who turned tobacco into a cultural icon. He didn't sell facts, he sold feelings. He convinced women that smoking was a symbol of liberation. He called them torches of freedom. He didn't target lungs, and he targeted identity. And it worked. So when it came time to sell fluoride to the masses, the playbook was already written.
This week, the U.S. Health Secretary said he wants to stop fluoridating water. Robert F. Kennedy Jr. plans to tell the CDC to stop recommending it and start a task force to study the issue. However, many dentists are pushing back against his ideas. Fluoride strengthens our teeth, which prevents cavities, and cavities can lead to numerous health issues. Dr. Margaret Gingrich, a dentist from the Big Rapids area, says putting fluoride in drinking water has made a visible difference in her patients' health. This is especially true for those in a rural area or without access to toothpaste or dental care.
This time, the product wasn't rolled in paper. It was dissolved in water. And once again, Bernays was behind the curtain. Crafting a narrative where fluoride wasn't just useful, it was essential, not a choice, a duty. Fluoride became more than a chemical. It became morality, cleanliness, responsibility. Parents who questioned it were irresponsible. Doctors who opposed it were misinformed. Communities that resisted were anti-science. Fluoride wasn't accepted because it was proven. It was accepted because it was repeated. Until questioning it sounded ridiculous, until everyone believed.
Fluoride is safe and effective, and it's one of the most inexpensive ways to really cut down on dental decay. Fluoride is safe and effective. Fluoride is safe.
Fluoride is safe and effective.